Hello everyone, this is Dr. Priyankita and I am going to take your rapid revision for FMG, and today we are going to start the anatomy of the lower limb part 2. So in the part 2 we are mostly going to cover almost entire thing whatever is left behind. Yesterday we have discussed till the thigh, so whatever is left behind today we are going to start, and let us start. Okay. So this is a very famous question recently asked in the FMC exam, that is fibula is present in. Now you have seen a X-ray here, okay, and then they have marked a structure. So that is a fibula, and it is a type of sesamoid bone, and it is found in the tendon. So among the following, among which of the tendon of the muscle this fibula is found. So they have given the option: the medial head of gastrocnemius, the lateral head of gastrocnemius, the adductor longus and the adductor magnus. So before attempting this question, let us little bit study about the popliteal fossa. Okay, so popliteal fossa, as you know, it is present behind the knee, okay, the back of the leg. So you can see this fossa here. It is a diamond shaped fossa. Okay, it's a diamond shaped fossa. As you can see the shape, it's in the shape of a diamond, right? It's in the shape of a diamond. Okay, now what are the boundaries of the popliteal fossa? So superomedially you have a tendinous like muscle, that is the semitendinosus. This is the semitendinosus, and then you will have another muscle which is a little bit membranous like, that is the semimembranosus. Okay, so this is the medial and this is the lateral. So superomedially you have the semitendinosus and the semimembranosus, and superolaterally, as you can see, this muscle is the bicep femoris muscle. So superolaterally you have the bicep femoris. Inferomedially you will have the medial head of gastrocnemius and the lateral head of gastrocnemius. So they have mentioned about the medial head of gastrocnemius and the lateral head of gastrocnemius. So now you know the boundaries of popliteal fossa. So if you see, superomedially you have semimembranosus and semitendinosus, those are your hamstring muscles, and then you got the bicep femoris in the superolateral position. Then in the inferomedially you have the medial head of gastrocnemius and the lateral head of gastrocnemius, supplemented by a tendon of plantaris. Okay, so you also have the plantaris on the inferolateral boundary. Okay, so supplemented by plantaris. Now fibula, what is fibula as asked in the question? It is a small sesamoid bone. Okay, it's a sesamoid bone, and you know that sesamoid bone ossifies in the tendon. So this is a bone. Okay, this is a bone which ossifies in the tendon of lateral head of gastrocnemius, and this is behind the lateral condyle. Okay, so now you know that if you start to attempt this question, that it is a sesamoid bone. As you can see here, this structure, it is a sesamoid bone present in the tendon of lateral head of gastrocnemius. So the fibula is present in the tendon of lateral head of gastrocnemius. So the answer will be the lateral head of gastrocnemius, and fibula is a sesamoid bone. You also have a large sesamoid bone, that is the patella. You can see in this area, this is the patella. Okay, so opposite to the patella, if you can see a small sesamoid bone, and sometimes they might ask in an X-ray. Okay, so identify the mark structure, and this structure is ossifying in tendon of which of the following. So they might ask in an alternate way also. So the answer is your lateral head of gastrocnemius. So fibula is present in the tendon of the lateral head of gastrocnemius. So this is the answer. Alright, so that's why I told that you have to study about the popliteal fossa, because in the previous year they have asked about the fibula. Okay, sometimes they might ask you about the boundaries of the popliteal fossa. So as a whole you should revise the popliteal fossa. So we have studied the boundaries now. Now you can see here again, same thing I have shown you, same x-ray. So you can see the fibula here, you can see the patella here. Alright, and this is the fibula, this is the tibia. Yesterday we have already studied about the x-ray. Alright. Okay. Now, what are the structures forming the floor of the popliteal fossa? So, the following structures are forming the floor. You have the popliteal surface of the femur. Okay, so you have the bone, femur bone, and the popliteal surface of the femur bone. Then you have the capsule of the knee joint and a ligament, that is the oblique popliteal ligament. So sometimes they might give a question on the oblique popliteal ligament as well. Okay, and the popliteal fascia covering the popliteus muscle. So popliteus muscle is one of the muscle found on the back of the leg. It is a deeper muscle. So here you can see in this image they have shown you. Okay, so this is the popliteal surface of the femur. All right. Then you can also see the capsule of the knee joint. Let me draw. This is the capsule of the knee joint. Okay, it is also forming the floor of the popliteal fossa. Then you have a ligament, and that ligament is the oblique popliteal ligament. All right, and then you have a muscle, that is a deep muscle on the back of the leg, and a fascia covering that muscle is known as the popliteal fascia. So you have the fascia covering the popliteus muscle. So similarly in this cadaveric image, okay, if you can identify the boundaries, so you can see that this is a diamond shaped popliteal fossa, right? This is a diamond shaped popliteal fossa. So you have the semimembranosus muscle superomedially and also the semitendinosus muscle. Okay, on the superolateral aspect you have this muscle, that is the biceps femoris. Below you will have the medial head of gastrocnemius. As you can see, this is the medial head of gastrocnemius, and then this is the lateral head of gastrocnemius, and here they are showing a nerve. So the sciatic nerve will be dividing into the tibial and the common peroneal nerve on the upper half of the popliteal fossa. So you can see that, you can see this nerve. This nerve is the tibial nerve. Okay, and this nerve on the side, this is the common peroneal nerve. Now we'll get many questions on the common peroneal nerve and the tibial nerve. So you should know that this nerve are the contents of the popliteal fossa. Alright. So these are the branches of the sciatic nerve. So sciatic nerve is, there are variations also, but mostly they are dividing on the upper half of the upper one-third of the popliteal fossa into the tibial nerve and the common peroneal nerve. Alright. Okay, so the floor we have already discussed that it is formed by the popliteal surface of the femur bone, the capsule of the knee joint, the oblique popliteal ligament, and a fascia covering the popliteus muscle, that is the popliteal fascia. Alright. Now, if there is a floor, there must be a roof, right? So if you are seeing the leg, you can think about this as the knee joint. Okay, this is the anterior aspect, okay, and this is the posterior aspect. Now the roof will be the skin behind, okay, so this will be the roof or the posterior aspect, right? Like this, on the posterior aspect you have the skin. So the roof will be formed by, first of all you will have a superficial fascia, skin and superficial fascia. Okay, and the superficial fascia over the roof will contain certain structures. Now yesterday we have studied about the great saphenous vein. Today we are going to study about the short saphenous vein, a small saphenous vein. Okay, so you have a short saphenous vein in the roof. Then you will have 3 cutaneous nerve. Now these nerves are very very important because sometimes you might get a question on this cutaneous nerve as well. So you have a terminal part of the posterior cutaneous nerve of thigh, okay, and then you have the posterior division of medial cutaneous nerve of thigh and the sural communicating nerve. Okay, now the important thing, whenever there is an exception to anything, so there is a chance that you might get an MCQ or an exception. So all the structures pierce the roof, okay, except the posterior division of the medial cutaneous nerve of thigh. Now this medial cutaneous nerve of thigh is coming from the thigh, because yesterday we have already studied about the what are the cutaneous divisions of the anterior part of the thigh and the posterior part of the thigh. So you can see in this area, okay, see, as you can see, this is the popliteal fossa. This is a diamond shaped popliteal fossa, okay, as discussed. Now these are the nerves, cutaneous nerves, which are in the superficial fascia, okay, these are in the roof, not just now we have discussed about a tibial and a common peroneal nerve. Those are the contents of the popliteal fossa, and this cutaneous nerve are present in the roof of the popliteal fossa. So you can see a nerve coming here, it is piercing the roof, and this nerve is the posterior cutaneous nerve of thigh, the terminal part, okay. Then you can see a nerve that is a sural communicating nerve, and another nerve which is very important, that is the posterior division of the medial cutaneous nerve of thigh. Now you can see that all this nerve, all the structures as well as this short saphenous vein, okay, the short saphenous vein, all the structures are piercing the roof except this structure which is coming from above, okay, and this is just lying on the roof. So this is the posterior division of the medial cutaneous nerve of thigh, which is not piercing the roof, okay, but it is a content of the roof. All right. Also, it is formed by the strong popliteal fascia. The roof is also formed by the strong popliteal fascia. So this is about the roof, that is the posterior wall of the popliteal fossa. All right. Now let us come to the contents. So in the contents, you have the popliteal artery as it is present in the popliteal fossa. So you have the popliteal artery and its branches. Then you will have the popliteal vein and its tributaries. Just now we have discussed that you will get the tibial nerve and the common peroneal nerve. Okay, and you will also get the lymph nodes, the popliteal lymph nodes and the popliteal pad of fat. Okay, these are the contents of the popliteal fossa. Now in addition to this, you might also get, because the posterior cutaneous, you might also get a posterior cutaneous nerve of thigh which is in the roof. You will get a descending genicular branch of the obturator nerve and terminal part of the short saphenous vein. So these are the additional structures. So you can see here. Okay, let me show the tibial nerve with green color. Okay, so this is the tibial nerve. Okay, and this is the common peroneal nerve, right? And then you can see the artery. This is the popliteal artery and its branches and the popliteal vein with its tributaries. Okay, and there are certain lymph nodes in the popliteal fossa, and you have fats, popliteal pad of fats. So these are the contents of the popliteal fossa. So why I am talking about the contents, sometimes they might ask the question like, which of the following are the contents of the popliteal fossa except, so they might give an option like popliteal nerve. So you don't have a popliteal nerve, okay, it came in some NEET PG, okay. So they will give all these options, popliteal artery, popliteal vein, tibial nerve, and they will give you popliteal nerve. So popliteal, you don't have any popliteal nerve, you have the tibial nerve and the common peroneal nerve. So you should remember the contents of the fossa. All right. Okay, now there are certain relations of the artery, vein and nerve in the popliteal fossa. Now if you don't want to remember the mnemonics, I will just explain in the fossa. It's very easy to remember. This is the medial aspect, okay, and this is the lateral aspect. Okay. Now just try to remember that the popliteal artery will traverse from medial to lateral. As you can see, the popliteal artery is traversing from the medial to the lateral. So इधर भी lateral है, ये medial है ना? So the popliteal artery is traversing from medial to lateral. If you just remember that, and then you can see the vein is traversing, okay, on the medial aspect, and the nerve, let me show you the green, the tibial nerve is going straight. है ना? So now if they ask you about the relation in the upper part, as seen, the artery, the popliteal artery, this is the artery, this is the artery, this is the vein, and this is the tibial nerve. So you can see that the artery lies medially. Okay, the artery lies medially. In the central part, okay, if you go from the superficial to deep, okay, now you can see that this green structure is a nerve. So superficially you will have the nerve, then you will have the vein, and then you will have the artery. So the artery is the deepest in the central part. Okay, just think about the artery, it is the deepest in the central part. Now the lower part, as you can see, from medial to lateral, the most medial structure here is the nerve, then you got the vein, and then you have seen that the artery has come to the lateral aspect. So the artery will be lateral. Okay, so just try to remember that the popliteal artery will be traversing from the upper aspect of the diamond shaped fossa, right, from the medial to the lateral aspect. So just try to remember one thing, that popliteal artery traverses, okay, from medial to lateral as it goes down the fossa. Okay, so as it goes down the fossa, the popliteal artery is going to see the upper part, it is medial, in the middle part it is deep, and in the lower part it is lateral. So just try to remember about the popliteal artery. So the popliteal artery is medial in the upper part, okay, and the popliteal artery will be in the deeper aspect in the deeper aspect in the middle part, and it is in the lateral aspect in the lower part. So that is the funda to remember about the relation. All right. Now let us study about the popliteal pulse, because so many question has been set up on the popliteal pulse or the dorsalis pedis pulse, mostly on the peripheral pulse. Okay. So the popliteal pulse, how do you feel the popliteal pulse? So first of all, you will flex the knee so that you relax the popliteal fascia, and then you will put your fingers, as you can see here, they have put the fingers, you put both of the fingers of both the hands in the popliteal fossa with the thumb resting on the patient's patella. Now this pulse is the most difficult pulse to feel among the peripheral pulse. So it's least likely we feel this pulse, but जब भी हमको कोई और दूसरा peripheral pulse नहीं मिलता है, we feel the popliteal pulse by flexing the knee. Okay, if you have to remember that the knee is flexed. ठीक है? Okay. Now there is a condition known as the popliteal aneurysm. So what do you mean by aneurysm? So aneurysm means if there is weakness in the wall of the blood vessel, there will be swelling. You can see this, there is a bulge. Any weakness in the wall of the blood vessels. Okay, you can see the bulge here. Okay, so that is aneurysm. Now this is very prone to aneurysm, okay, than any other artery, and clinically it will present as a pulsatile midline swelling in the popliteal fossa. Now important thing here to remember is pulsatile, pulsatile swelling. Why I am telling you about the pulsatile swelling? Anywhere, if you get a question that there is a swelling which is pulsatile, just think about aneurysm. Okay. Now there might be a differential diagnosis. You might get a photo with the swelling on the popliteal fossa, and if they have not mentioned about the word pulsatile, okay, it is just a swelling which is cystic, then it is a different condition. Alright, so popliteal aneurysm will be pulsatile in the midline, and it is mostly due to the weakness of the blood vessel. Okay, popliteal blood vessel, that is a popliteal artery. Now there is another condition where you will have a swelling on the back of the knee, that is the popliteal fossa. Now this swelling, the characteristic feature is that it is cystic. Okay, it is cystic due to inflammation of the bursa underneath the semimembranosus, or there might be protrusion of the synovial membrane of the cavity of the knee. So this swelling will be cystic. As you can see here, this is the swelling, right? So this swelling will be cystic. So it might be due to an inflammation of the bursa behind the semimembranosus, or due to the protrusion of the synovial membrane. So this is known as Baker's cyst. Okay, so this is known as Baker's cyst. So if you have swelling in the popliteal fossa, okay, now if the swelling is pulsatile, so if the swelling is pulsatile, then what kind of diagnosis we will make? It is popliteal aneurysm. Okay, so it is popliteal aneurysm if the swelling is pulsatile, and if the swelling is cystic, so it will be your popliteal cyst, and that is also known as Baker's cyst. Okay, so those are the differential diagnosis. So if the swelling in the popliteal fossa is pulsatile, so it is popliteal aneurysm. If it is cystic, then it is Baker's cyst or popliteal cyst. Alright, so I hope now it is clear to you. Now let us attempt some question. What is the nerve supply of the popliteus muscle? So we have just come across that the fascia covering the popliteus muscle is forming the floor of the popliteal fossa. So they have given the nerve, those are tibial nerve, common peroneal nerve, popliteal nerve and deep peroneal nerve. Now from this two, you know that deep peroneal nerve, popliteal nerve तो है ही नहीं, then deep peroneal nerve is also not another option. Now you are confused between the tibial nerve and the common peroneal nerve. Now to understand this, you have to understand the different compartments of the leg and what are the nerves supplying the different compartments of the leg. So let us first study about the compartments, and then we will come back to this question again. Alright. So try to remember this diagram. Okay. This is very, very important. If you remember this diagram, then you will solve maximum of the question. Okay. If you can remember this cross section, you don't need anything, because इसमें सब नर्व सप्लाई ब्लड सप्लाई सब कुछ है. सो अगर ये तुम लोग याद रख सको, then it will very, very easy for you. Now just imagine this is a cross section. Okay, the cross section taken at the level of the leg. So you have certain intermuscular septum which is dividing the entire leg into compartments. Okay, so here you can see that you have a posterior intermuscular septum. This is the posterior intermuscular septum. All right. And then you have a deep transverse septum and a superficial transverse septum. Then you also have the interosseous membrane here. Okay, now the part which is lying anteriorly. So this part, mostly this part, is the anterior compartment of the leg. Okay, and the anterior compartment of the leg is the extensor compartment. Extensor compartment. Now the nerve to the anterior compartment of the leg is the nerve to the anterior compartment of the leg. This nerve, okay, is the deep peroneal nerve. ठीक है, तो एंटीरियर कंपार्टमेंट का कोई भी मसल आ गया उसका नर्व सप्लाई, if they asking, the answer will be deep peroneal nerve. You can close your eyes and tick mark the answer. Deep peroneal nerve is also known as the anterior tibial nerve. Okay, and the artery of the anterior compartment, the artery of the anterior compartment is the anterior tibial artery. All right. Now if you see the posterior compartment, okay, the posterior compartment का main nerve जो है, this nerve, that is the tibial nerve. Any muscle, okay, if they ask on the posterior compartment, so we'll study one by one what are the muscles in the compartment. So posterior compartment का कोई भी muscle दे देंगे and they will ask you the nerve supply, so the answer will be your tibial nerve. Okay, and you have two arteries here. So you have a posterior tibial artery and you have a peroneal artery. Okay, दो artery है. And there is a lateral compartment. तो lateral compartment का जो nerve है, that nerve is a superficial peroneal nerve. ठीक है. So anterior compartment का कोई भी muscle आ गया तो उसका nerve supply will be your deep peroneal nerve. Lateral compartment का muscle जो है, that is a superficial peroneal nerve. The posterior compartment, that is the tibial nerve. ठीक है. Now you got to know the nerve of the compartment. Artery of the anterior compartment is anterotibial artery. Artery of the posterior compartment is posterior tibial artery and the peroneal artery. And superficial the lateral compartment, it doesn't has its own artery. It gets the collateral from the other arteries. Okay. Okay. Now, if a question came to you that the medial compartment of the thigh is supplied by, this is the thigh question, okay, this is not about the leg, they are asking about the medial compartment of the thigh. Okay, ये तुम लोग याद करो. I will come back to you at the end of this. This is not leg, this is about the thigh. तो medial compartment, the adductor compartment, उसका कौन सा nerve था, कल हमने already discuss किया. You just think about it. We'll come at the end to discuss it. Okay, let's study about the muscles on the back of the leg. Okay, so we have two groups of muscle. There is a superficial group of muscle and there is a deep group of muscle. Now in the superficial group you have the gastrocnemius as already discussed. Then you have the soleus and you have the plantaris muscle. These are the superficial group. And in the deep group we have the popliteus muscle, okay, the flexor digitorum longus, flexor hallucis longus and the tibialis posterior. So these are the groups of muscle. The superficial groups are three, that is gastrocnemius, soleus and plantaris, and the deep muscles are the popliteus, flexor digitorum longus, flexor hallucis longus and the tibialis posterior. Okay, you can see in this image, this is the gastrocnemius muscle, the medial head and the lateral head. Okay, and if you remove the gastrocnemius, you will get another muscle, that is the soleus muscle. And here you can see the tendon of the plantaris. This is the tendon of the plantaris muscle. ठीक है, तो ये हो गया आपका soleus gastrocnemius, and they are inserting through a common tendon, that is the tendoachilles or the tendocalcaneus. ठीक है, ये हो गया आपका superficial group of muscle. So we have already seen the superficial group as discussed, that you have the gastrocnemius, you have the soleus and the plantaris, and all these muscles are supplied by, okay, all these muscles are the muscles of the posterior compartment. ठीक है, तो क्या supply करेगा? You know that the nerve of the posterior compartment is the tibial nerve. तो सबका tibial nerve होगा nerve supply. Okay, and what are the action? The action are plantar flexion of the ankle when the knee is extended, and also flexion of the leg and the knee joint. Similarly, this plantaris is a very weak plantar flexor, and the soleus is also helping in plantar flexion of the ankle. Okay, so these are about a superficial muscle. If you go to the deep muscle, so deep muscle में हम लोग का क्या क्या muscle है? We have studied about the popliteal, the FDL, the flexor digitorum longus, flexor hallucis longus, and the tibial is posterior. Now these are also the muscles of the posterior compartment. तो सबका nerve supply will be your tibial nerve. All the muscles of the posterior compartment are supplied by the tibial nerve. ठीक है? So let us come back to this question again. What is the nerve supply of popliteus muscle? Now anybody can answer in the chat box. अभी अभी हम लोग ने discuss किया है muscles on the back of the leg. So all the posterior compartment muscles are supplied by the tibial nerve. ठीक है? All the posterior compartment muscles are supplied by the tibial nerve. So popliteus is a deep muscle. Deep muscle, so it is supplied by the tibial nerve. What about this, the medial compartment of thigh? So कल हम लोग ने already पढ़ा है thigh के बारे में. So you know that the femoral nerve, it is the nerve of the anterior compartment. Tibial nerve and common peroneal nerve are the branches of the sciatic nerve, which is the nerve of the posterior compartment. So the adductor compartment or the medial compartment of the thigh is supplied by the obturator nerve. ठीक है? Okay. Tibial is posterior, is supplied by which of the following nerve? Now you know that tibial is posterior, this muscle, tibial is posterior, it is the deep muscle. Okay, just now we have studied that tibial is posterior, is a deep group of muscle in the posterior compartment. So this is a muscle of the posterior compartment. Again, same thing. If you know how to answer, you will answer all the question correctly. So this is the muscle of the posterior compartment. And what is the nerve of the posterior compartment? It is the tibial nerve. So they have mentioned about sural nerve, femoral nerve, deep peroneal nerve. So the answer here will be the posterior tibial nerve. This is the correct answer. All right. What is the nerve supply of soleus? तो अभी अभी हम लोग ने पढ़ा है soleus is again in the posterior compartment. And it is in the superficial group, right? So what is the nerve supply? Again the nerve supply will be your posterior compartment का nerve. आँख बंद करके तुम लोग tibial nerve answer मारो. Okay, this is the correct answer. The answer is your tibial nerve. You don't have to look to any other options also. If you know that what are the muscles of which compartment, it's very easy to attempt the question. All right. Now this gastrocnemius and soleus. Okay, the gastrocnemius and soleus together, they are known as triceps suri. Okay, they are inserting through a common tendon, that is the strongest tendon, that is the tendoachilles. Okay, So any doubt you can ask in the chat box. I am here to answer your doubt. Okay, कोई भी डाउट है तुम लोग पूछ सकते हो चैट बॉक्स में. Okay. Now, as I told you that both the heads of the gastrocnemius, the two heads of the gastrocnemius and soleus are together known as the triceps suri. So sometimes you might get a question on the triceps suri. So it is nothing but together the gastrocnemius and the soleus, okay? And they are supplied by again the tibial nerve. Now, as already discussed, you have a small sesamoid bone on the, what is important here to remember is on the lateral head of the gastrocnemius. So this is one question which has been repeated in the FMGE. There is a small synovial bursa which lies deep to the medial head. Okay, so they might ask a question on the medial head next time. So that is the broadis bursa. Okay, so if they ask about the broadis bursa, it is deep to the medial head of gastrocnemius. If they ask about the sesamoid bone, that is on the lateral head of the gastrocnemius. Now, tendocalcaneus or tendoachilles, which we have already discussed, it is very strong tendon. Okay, they have the gastrocnemius and soleus together insert as a tendoachilles tendon, and it is very thick and very strong in the body, which is around 15 centimeter. Now, this is a prime mover for plantar flexion of the foot at the ankle joint. So, tendoachilles का function है your plantar flexion at the ankle joint. So you have seen here this tendon, the common tendon for the insertion of the gastrocnemius and the soleus, that is the triceps suri, that is known as the Achilles tendon, and the gastrocnemius and the soleus are known as the calf muscle, okay, or the triceps suri. Okay. Now, what is tennis leg? Okay, there are different types of legs. You will get legs and knees and elbows. Okay, you have heard about tennis elbow, so you have a tennis leg. You have heard about a golfer's elbow. Okay, there is no golfer's leg, but okay, so you have a tennis leg. Now, what is tennis leg? If there is a strain or tear in the medial head of the gastrocnemius. So another question which might come on the medial head, one is the broadis bursa, another is the tennis leg. So if there is tear or strain on the medial head of gastrocnemius at its musculotendinous junction due to overstretching, then it may lead to a condition known as tennis leg. Commonly occur in tennis player. They will stretch their gastrocnemius too much, and that will result in a condition known as tennis leg. It's a painful condition. Okay, so you have seen here. So you will mostly have on the medial head of gastrocnemius. Okay, tear or strain on the medial head of the gastrocnemius. Okay, so that is tennis leg. Now question comes on peripheral heart. Okay, so you have a heart in the lower limb. Okay, and that is not the main heart, mind you, that is the peripheral heart. Okay, so this is the peripheral heart, and peripheral heart here is the soleus muscle. Sometimes you mark this as gastrocnemius, so it is the soleus muscle. And why it is called a peripheral heart? Because it has sinuses. Okay, it has venous sinuses. It has venous sinuses. Those are known as the soleal sinuses. They are communicating with the superficial vein by the perforating and the deep veins. So what happens when there is contraction of the soleus? This will help in sucking the blood from the superficial veins and propelling it into the deep veins. Okay, so because of the sinuses, the soleus is known as your peripheral heart. Okay, so sometimes you are asked in the, if you remember in your first year MBBS, like in the dissection hall, the teacher will say that just tap your legs, okay, if you are feeling giddy, and also if you are tapping your legs, you are contracting your soleus, and it is sucking the blood from the superficial veins and propelling it into the deeper veins. So that's why it is known as the peripheral heart or the soleus. Okay, so this might come as a question. If not, this has been not asked in any FMD exams, but in the NEET it has come. So you might expect a question the next FMG, the peripheral heart. Okay, so it is not gastrocnemius, mind you. Triceps suri is the combination of both the gastrocnemius and the soleus, and if the question comes on the peripheral heart, it is the soleus muscle because they have soleal sinuses. All right. Now, this is a question which has been repeated in one or two FMGs. Okay, so the posterior tibial artery pulse. They have asked this question in many ways. Sometimes they have asked by giving an image, and they are asking identify the artery in which the pulse is felt. Sometimes they are giving such a big options. Okay, so this has been repeated many times. It's very important every time they are asking a question on your posterior tibial artery pulse, either an image based question, either a objective question. So you have to know about the posterior tibial artery pulse and the posterior tibial artery as well. It's so common. Every alternate, sometimes in the same year also it is repeated. So you can't neglect this posterior tibial artery pulse or the posterior tibial artery. So let us study a little bit about the posterior tibial artery. Now this pulse, the posterior tibial artery pulse, before going into that, let us come to the posterior tibial artery. Now, from where does this posterior tibial artery arise? It is arising from the popliteal artery. It is the larger branch. They have two terminal branches. It is a larger branch from the popliteal artery, and it supplies the posterior compartment. हमने देखा था posterior compartment में दो artery था, एक था posterior tibial artery, एक था peroneal artery. So the posterior tibial artery is the larger one. Okay, and it is also supplying the lateral compartment. Now the lateral compartment का खुद का कोई blood supply नहीं है, so it gives the collateral from the posterior tibial artery. Okay, and it is also supplying the sole of the foot. So that's how it is very important. Now what are the branches of the posterior tibial artery? So you have the peroneal artery. Okay, then you have the muscular branches which will be supplying the muscles. You have the nutrient artery of the tibia, the circumflex fibular artery, communicating branches, and then in the malleolus you will have the medial malleolar branch. In the calcaneum it will give the calcaneal branch, and then you will have the terminal branches. So these are the branches of the posterior tibial artery. If you have to see this image, okay, now you can see a muscle here, that is a popliteus muscle. Okay, popliteus muscle. So popliteus muscle के ऊपर जो artery है, this is the, let me show you the purple color, this is the popliteal artery. Okay, ऐसा आ रहा है popliteal artery. Okay, now it is dividing. In the lower border of the popliteus muscle, it is dividing to two parts. So you have a larger branch. This is the posterior tibial artery. This is a larger branch. And then you have a smaller branch also. The smaller branch is the anterior tibial artery. Okay, so the popliteal artery is giving your posterior tibial artery and the anterior tibial artery. Anterior tibial artery supplying the anterior compartment. Posterior tibial artery supplying the posterior compartment along with its branches. Okay, now this posterior tibial artery, as it will go down, it is giving another branch, that is the peroneal artery. Okay, and then you can see as it is going down, it is giving the medial plantar artery along with the nerve, and the peroneal artery is also going down, and it is giving perforating branch of the posterior tibial artery. It is giving the communicating branches, and then it is also giving the calcaneal branches. Okay, so this is about the posterior tibial artery. So you know that it is a branch, larger branch of the popliteal artery, and it has the different branches. Okay, so it will supply the posterior compartment. It will also give some supply to the lateral compartment, also to the sole of the foot. Now now let us come to the pulse. How do we feel the pulse? How do we feel the posterior tibial pulse? So this posterior tibial pulse can be felt against the calcaneum bone, okay, about 2 centimeter below. And the important part here is that it is felt behind the medial malleolus, okay, and in front of the medial border of tendocalcaneus. Very important to remember. सो पोस्टीरियर टिबियल आर्टरी पल्स हम लोग कहाँ फील करते हैं? अगेंस्ट द कैल्केनियम बोन, ओके, अबाउट 2 सेंटीमीटर बिलो, बिहाइंड द मीडियल मेलियोलस एंड इन फ्रंट ऑफ द medial border of tendocalcaneus or the tendoachilles. Now, when we feel this pulse, it is very important to ask the patient to invert his foot to relax the flexor retinaculum. Otherwise, it is very difficult to feel this pulse. Okay, so if you don't invert the foot and then if you directly feel the pulse, then you might get an erroneous conclusion. You might get an absent pulse. So you can't say that a pulse is absent without asking the patient to invert the foot. So you have to ask the patient to invert the foot. है ना? So you can see here the foot is inverted. The foot is inverted. You have the medial malleolus here. ठीक है? So medial malleolus के behind, this fell behind, and जो तुम्हारा tendoachilles है, so you know that there is a tendon here, है ना? There is a tendon here that is known as the tendoachilles. तो उसका medial border, okay, so it is felt behind the medial malleolus and in front of the medial border of the tendoachilles. This is tendoachilles and this is the medial malleolus. ठीक है? So the posterior tibial artery pulse is felt behind the medial malleolus and in front of the medial border of the tendoachilles. ठीक है? So now it is clear to you कैसे हम लोग feel करते हैं. इधर also same thing. You know that this is the posterior tibial artery. Okay, and then you have a bone here. This is the medial malleolus. So medial malleolus ठीक है, इधर है medial malleolus और इधर है tendoachilles. So here you have the tendoachilles, the tendon. ठीक है. Now you can see that the pulse is felt. इसका ये है medial border. This purple shaded is the medial border of the tendoachilles. ठीक है. So this posterior tibial artery pulse, this is felt behind the medial malleolus and in front of the tendoachilles at the medial border of the tendoachilles. ठीक है. So this is the correct way and you have to ask the patient to invert the foot. Without inversion you will get an absent pulse. So that is the technique of observing the posterior tibial artery pulse. Now let us come back to this question. So posterior tibial artery pulse is felt in between. So you know now that it should be medial malleolus, एक तो है correct answer, and next is the medial border of the tendoachilles. Three things you have to remember: medial border of the calcaneus, tendon of the calcaneus, and next is the inversion. अदर ऑप्शन में मीडियल मेलोलस दिया हुआ है, मीडियल बॉर्डर दिया है, इवर्शन दिया हुआ है, इधर में लैटरल बॉर्डर दिया है, इधर भी एंड इसमें तुम्हारा लैटरल बॉर्डर एंड इवर्शन. सो दिस आर रॉन्ग, दिस इज अदर ऑप्शंस, ये गलत है. This is wrong, this is wrong, this is wrong. So the correct answer here is the A. Okay, so between the medial malleolus, or behind the medial malleolus, in front of the tendoachilles, in the medial border, and in inversion. So that is the correct answer. So they might give you a image based question and ask you which artery is taken here for the peripheral pulse. So the answer will be, if you see the medial malleolus, if you see the inversion, so, and if you say it is in the medial border of your tendoachilles, then it is your posterior tibial artery pulse. That's how you attempt the question, right? Similarly, they have given an examiner is palpating the artery in which of the following image. You can see here, देख के पता चल रहा है, ये तो है तुम्हारा मीडियल मेल्योलस, ठीक है, ये है तुम्हारा टेंडोएक्विलिस, इसके मीडियल बॉर्डर, तो इसके बीच में देख रहा है ना. सो दिस विल बी योर पोस्टीरियर tibial artery. The answer will be posterior tibial artery. Okay, that's how you will attempt a question. So sometimes they will ask you image based questions, sometimes they will give you options like this. Okay, so it is repeated again and again, 2020, 2021, so you never know, it might come in 2024, 25, never know. Okay, let us come to the lateral compartment of the leg. Before coming to the lateral compartment, let us study a little bit about the dermatome of the back of the leg. Okay, so a question came on the dermatome. They had given an image of the dermatome, so you have to know about a dermatome as well. So you know that on the upper half of the thigh, you can see on the lateral aspect, you have the lateral cutaneous nerve of thigh, that is by L2, L3. On the medial aspect, you have the medial cutaneous nerve of thigh, that is again L2, L3, and then you have the posterior cutaneous nerve of thigh. All right. Again, on the leg, you can see that lateral cutaneous nerve of thigh, L4, L5, and S1. Now, how is this division? That is important. Okay, this side is saphenous and idhar mein hai sural. Now, the dermatomal divisions I will discuss in the last 2-3 slides. Okay, so that is important, and this is the cutaneous innervation of the nerve. So, we'll study about the dermatomal innervation in the last 2-3 slides. Let us come to the lateral compartment of the leg. So you have only two muscles in the lateral compartment. Those are your peroneus longus, that is larger, and very important to remember, it lies superficial to the peroneus brevis. And then you have the peroneus brevis, it is smaller, brevis means smaller, and it lies deep to the peroneus longus. So the superficial muscle, the tendon of the peroneus longus will be superficial, and the tendon of peroneus brevis will be deep. Now, since it is in the lateral compartment, you know that the nerve for the lateral compartment is your superficial peroneal nerve. So, कोई भी question आए on the lateral compartment muscle, the nerve supply will be a superficial peroneal nerve. The main function of the lateral compartment muscle is eversion of the foot. Okay, it also maintains the lateral longitudinal arches, you know, the arches of the foot, but the main function is the eversion of the foot. So the everters of the foot are the muscles of the lateral compartment, that is the peroneus longus and peroneus brevis. All right. Okay, now this is important because question came on the injury of the superficial peroneal nerve. So if there is injury of the superficial peroneal nerve, the first and the foremost function which will be gone is the loss of eversion. You know that the main function of the everters are your or the lateral compartment muscles are your eversion of the foot, because there will be paralysis of the peroneus longus and the brevis. Secondly, there will be sensory loss on the lateral aspect of the leg. Okay, so sensory loss bhi gaya. Thirdly, important, sensory loss on the dorsum of the foot, but there is exception. Whenever there is exception, there is a question on that. Okay, so you have got two questions on this superficial peroneal nerve injury. Except the web space, first web space, the dorsum is supplied by the superficial peroneal nerve, and the first web space is supplied by the deep peroneal nerve. You have to remember this because it has been repeated in the FMG exams, and you know that the questions is to get repeated in the FMG. All right. So कोई तरह के क्वेश्चन आ सकते हैं कि they might ask you there is a loss of eversion, there is sensory loss on the lateral aspect except on the first web space. So the answer will be superficial peroneal nerve. Let us see here. You can see this is the common peroneal nerve. Okay, it is giving a branch anterior tibial recurrent. Then you have a branch going here, that is a deep peroneal nerve. Okay, deep peroneal nerve, and then you have another branch that is a superficial peroneal nerve. Superficial peroneal nerve is supplying the lateral compartment. So it gives branches to the peroneus longus and the peroneus brevis. So you can see the dermatomal innervation here, that this is the innervation of your common peroneal nerve, and below mostly the lateral aspect of the leg is supplied by the superficial peroneal nerve, and the lateral most on the dorsum is supplied by sural nerve. And here in the first web space, very important, the first web space is supplied by the deep peroneal nerve. Entire dorsum except the first web space is supplied by the deep peroneal nerve, and the lateral most part is supplied by the sural nerve. The medial most part will be supplied by the saphenous nerve. Okay, so that is the dermatome. So which of the following muscle is the everter of the foot? अभी तो पता होना चाहिए that everters, they have given tibialis anterior, tibialis posterior, peroneus longus and extensor digitorum longus. So you know that the everters are muscles of lateral compartment. Compartment of leg. And we have only two muscles, those are peroneus longus and peroneus brevis. So what option you have here? That is the peroneus longus. So this is the correct answer. Okay. So the everter of the foot, tibialis anterior, tibialis posterior, extensor digitorum, सब कुछ भूल जाओ. Whenever the question comes on the everter, you just have to remember that lateral compartment muscles are the chief everters of the foot. So you have only two muscles there, peroneus longus and brevis. So they have given one option, that is peroneus longus. Okay. Most common nerve damage in the leg. Okay. So out of all this, femoral nerve, sciatic nerve, tibial nerve, the most common nerve damage in the leg is the common peroneal nerve. Okay. If this question comes, the most common nerve damage in the leg is common peroneal nerve. Okay. Now they have given a question that the nerve involved, okay, the nerve, you read the question properly, the nerve involved in difficulty in eversion, loss of sensation on the dorsal aspect of the foot, कौन सा होगा? Okay, so among this, they have not mentioned about the web space and all, but if you have to, पहले exclude करो, saphenous nerve तो है ही नहीं because it is on the medial side. Sural nerve also it is not there, it is on the dorsum, but extreme the little toe, towards the little toe. Now deep peroneal and a superficial peroneal. Now among these two, the answer will be your superficial peroneal because it is supplying the everters. Deep peroneal, it is supplying not, it is not supplying the the everters, right? Deep peroneal किसका nerve supply है? You can see in this image. Deep peroneal nerve, deep peroneal nerve is the nerve for the anterior compartment. Anterior compartment करता है extension, ठीक है? It is doing the extension. So ये गलत है जो आया है ऑप्शन. So the answer is your superficial peroneal nerve. आँख बंद करके तुम लोग को टिक मार्क करना चाहिए because loss of eversion, sensory loss on the lateral aspect काफ़ी है. Mark the आंसर एज योर सुपरफिशियल पेरोनियल नर्व। अभी अभी हम लोग ने पढ़ा है दैट सुपरफिशियल पेरोनियल नर्व के लिए लॉस ऑफ इवर्शन होगा एंड लैटरल एस्पेक्ट में सेंसरी लॉस होगा। सेंसरी लॉस डॉर्सम में होगा, फर्स्ट वेब स्पेस में नहीं होगा। फर्स्ट स्पेस क्योंकि फर्स्ट वेब स्पेस इज सप्लाइड बाय द डीप पेरोनियल नर्व। सो द आंसर इज योर सुपरफिशियल पेरोनियल नर्व। ठीक है। So we are done with the lateral compartment of the leg. Anyone has any doubt can ask on the chat box. अब तक कुछ doubt है तो? Anybody has doubt? Okay. So let us proceed to the medial side of the leg now. Okay. हम लोग ने already lateral side पढ़ लिया है. अभी हम लोग medial side of the leg पढ़ेंगे. So medial side is mostly subcutaneous. You know that. So medial side is mostly subcutaneous except there is insertion of certain muscles. Okay, one of the hamstring muscle is also getting inserted here. That is the semitendinosus. So insertion है, ठीक है, और ligaments है. Tibial collateral है, ligamentum patelli and tibial collateral ligament है, but बाकी it is subcutaneous. ठीक है, but there are certain things to be remembered on the medial side of the leg. That's why I am teaching you. इसमें bursa आता है. So question is to come on that bursa. So you can see here on the and this is a tibia, okay, and here you can see the insertion of certain muscles, okay. You can see the sartorius. It is inserting like a hockey stick pattern, ठीक है, sartorius. उसके बाद आएगा gracilis and then you will get the semitendinosus. इसका insertion है. You also have the groove for the semimembranosus and you have the tibial or the medial collateral ligament and you have the ligamentum patelli. ठीक है. Now this typical arrangement, okay, this typical arrangement where you have the sartorius in a hockey stick, pattern. This is the sartorius, then you have the gracilis, and then you have the semitendinosus. इनके बीच में you have a bursa. Let me draw with some other color. Okay, let me draw with yellow color. So you have this bursa. The shape is in this way. Okay, and this is a shape of goose foot. ठीक है, it is like a goose foot. Okay, this shape of the bursa is like a goose foot, and that's why it is named as your pes anserine. Okay, pes anserine bursa. That the meaning is like a because इसका shape है goose foot. So you know that there is goose का foot ऐसा होता है ना? So this bursa looks like a goose foot and that's why the name is known as the pes anserine bursa. Okay, you can also call it as a anserine bursa. ठीक है? So you can see here there is this muscle that is a sartorius. ठीक है, इधर insert हो रहा है. Then you have the gracilis and then you have the semitendinosus. इनके बीच में जो bursa है that is known as your pes anserine bursa because it looks like the shape of this bursa is like a foot of a goose. Okay, so it is known as pes anserine मतलब goose foot. Okay, so that's why it is known as pes anserine bursa. Okay, so अगर bursa है तो उसका inflammation होगा and it will lead to a condition known as anserine bursitis. Anything which has itis is inflammation. So this bursa will have inflammation that is known as anserine bursitis. Okay, so repeated trauma on the upper part of the medial aspect causes inflammation of the anserine bursa and that is known as anserine bursitis. It will cause pain and swelling. So you can see if you have a swelling On the medial side, okay, on the medial aspect of the leg, that is the anserine bursitis. Okay, so you can see different type of bursas here in the knee. We'll study again. So you have pes anserine bursa on the medial aspect. So you know that this is medial, this is lateral. So you got a bursa on the medial aspect, that is the pes anserine bursa. If you have a bursa above the patella, that is known as prepatellar bursa. Upar, in front of the bursa, that is the prepatellar bursa. If you have a bursa above the patella, that is the suprapatellar bursa, or below the patella you have the infrapatellar bursa. So patella के ऊपर है suprapatellar, patella के नीचे है infrapatellar, और patella के आगे है prepatellar, and in the medial aspect you have the pes anserine bursa. So for now you try to remember all this bursa. We'll again study the last 2-3 slides. So similarly in this image also you can see ये है patella, this is the patella bone. So patella के आगे you have the prepatellar bursa, and it is lying subcutaneously. So you have subcutaneous prepatellar bursa. Okay, then you also have subcutaneous below the patella, so it is infrapatellar bursa. ठीक है, फिर you will also have a deep infrapatellar bursa. तो दो bursa है, एक है subcutaneous infrapatellar, एक है deep infrapatellar, and then you will have suprapatellar bursa which is above that. ठीक है, behind you will get a bursa behind the tendon of your semimembranosus, that is semimembranosus bursa. इसमें अगर तुम्हारा inflammation हो गया, it will lead to your a cyst formation, that is your Baker's cyst. और नीचे on the medial aspect you will have your the subsartorial or the pes anserine bursa. थोड़ा medial ही होगा, ठीक है? Okay, so these are the bursas. Now let us come to a term which is known as guy ropes. So what do you mean by the word guy rope? Guy rope का meaning ये है कि you have seen a tent, right? Tent जब लगाते हैं in a jungle, you can see those ropes which are holding the tent and giving tension. Okay, इन rope को बोलते हैं guy ropes. ठीक है? जब tent लगाते हैं, you can see there is a tension built here, and these are attached to the ground by certain ropes. And these are known as your guy ropes. ठीक है, these are known as your guy ropes. Okay, now what are guy ropes in anatomy? So you know that there are muscles which are your sartorius, gracilis, and semitendinosus. These are the muscles which are forming that are inserting into the medial aspect of the tibia, and forming that in between they have the bursa, that is pes anserine. So these muscles are attached on the upper part of the medial surface of the tibia, and above they are attached wide apart on the hip bone. So the sartorius ऊपर किसके साथ attach है? With the ilium. You know that attachment is your anterior superior iliac spine. The gracilis on the other hand is attached to the pubis, and the semitendinosus is attached to the ischium, that is the ischial tuberosity. Now these muscles act as a guy rope because it stabilizes the bony pelvis on the femur. So you can see in this image, sometimes you might get a question on the guy rope. So you know that this is the muscle, this is the sartorius, this is the longest muscle, है ना? So it is attached on the anterior superior iliac spine. Then you have the gracilis, it's also known as the honeymoon muscle, right? So it is attached on the body of the inferior ramus of the pubis, and then you have the semitendinosus, it is attached on the ischial tuberosity. So just imagine this entire structure, which is a hip bone, it is like a tent. Okay, ये है इसका upper part, this is the tent, and these structures are these ropes which I have shown you. These are these guy ropes, and then they are attaching to one point. here on the tibia, on the medial aspect, that is the anserine, where you have the pes anserine bursa. So this, now you can imagine that this part of the hip bone is the tent, और ये नीचे का part जो है, this muscles, they are acting like a rope, okay, and it is building the tension, so it is stabilizing the hip, okay, and that's why the term came as gyro. ठीक है, so अगर the question comes on the guy rope, you should know that it is formed by the three muscles. Those are the sartorius, the gracilis, and the semitendinosus. They asked this question in the NEET exam. So instead of semitendinosus, they give another option. All of the following muscles are forming the guy rope except. So they will give you sartorius, gracilis, semitendinosus, and semimembranosus. So semimembranosus is not forming the guy rope. ठीक है, तो ये याद रखना कि ये भाई सेमीटेंडनोसिस है, ये मेम्ब्रेनोसिस नहीं है. Out of all this is important क्योंकि this question has been asked in the NEET exam. Okay, guy ropes में आता है तुम्हारा sartorius, आता है gracilis, you have the gracilis, you have the sartorius, and you have the semitendinosus. So they might give you semimembranosus to confuse you. Okay, so you should know that these three are the muscles forming the guy ropes. Okay, so we have ended the medial compartment of the leg. Now we are proceeding towards the anterior compartment of the leg. Now in the anterior compartment, you have the tibialis anterior, the extensor hallucis longus, the extensor digitorum longus, and the peroneus tertius. Now I told you that anterior compartment is the extensor compartment and the posterior compartment is the flexor compartment. तो इसीलिए the नाम में ही लिखा है extensor digitorum, extensor hallucis, peroneus tertius, and tibialis anterior because it is in the anterior compartment. And you know that mostly the tibialis anterior main function is your dorsiflexion of the ankle and inversion of the foot. ठीक है? It also maintains the arches. Extensor hallucis will, as in the name, it will help in extension, and also it is also a dorsiflector of the foot. And extensor digitorum भी तुम्हारा dorsiflexion कराता है, and peroneus tertius भी dorsiflexion कराता है. Also it helps in eversion of the foot as well. Okay, now there are certain muscles which are accessory muscles. So as I have discussed that there are main everters of the foot are your peroneus longus and peroneus brevis, and these are the chief or the main muscle, or accessory muscle which are helping will be your peroneus tertius. ठीक है? Now you know that anterior compartment का जो muscles है, those are supplied by the anterior tibial nerve and that is also known as your deep peroneal nerve. तो इनमें से कोई भी question अगर आया tibialis anterior, extensor hallucis, digitorum और peroneus, तो उसका nerve supply is your deep peroneal nerve or the anterior tibial nerve. Now let us study a little bit about the anterior tibial artery. We have already studied about the posterior tibial artery, how the pulse is felt. Now the question also comes on the anterior tibial artery branches, that is the dorsalis pedis. So you have to know a little bit about the anterior tibial artery as well. Okay. तो तुम लोग को पता है कि from the popliteal artery you have the posterior tibial artery and the anterior tibial artery. The posterior tibial artery is a larger branch. Now the anterior tibial artery, it also gives a recurrent tibial artery branch. Recurrent always goes in an opposite direction. Then this artery, as it comes down, so you can see it is giving anterior medial malleolar artery and anterior lateral malleolar artery. ठीक है? Then it becomes as the dorsalis pedis artery. It is also giving lateral tarsal and medial tarsal artery, the tarsal bones. Okay, and then it takes a turn, that is the arcuate artery. It also supply ये arcuate artery होने से पहले it deeps down, giving another branch is here, that is the first dorsal metatarsal artery. Let's see. Okay, so dorsalis pedis artery is coming from the anterotibial artery only. Okay. Up here you can see the muscles here. So you can see this is a tibialis anterior. This is the extensor digitorum longus, and this is the extensor hallucis longus. Okay, on each you have the peroneus tertius. Okay, and those are supplied by this nerve, that is the anterotibial nerve or the deep peroneal nerve. Okay, the deep peroneal nerve supplying all the muscles on the anterior compartment. Okay, and superficial peroneal nerve is supplying the lateral compartment. Okay. Okay, now let us come to the dorsalis pedis artery. Now it is a direct branch from the anterotibial artery, as you know. Now it can be easily felt between, very important, between the tendons of extensor hallucis longus and the first tendon of extensor digitorum longus. Okay? So you can see here in this image, extensor hallucis longus, it is going to get, as the name suggests, you have hallucis, hallux. What do you mean by hallux? Hallux matlab great toe. Pollicis agar ho, pollis matlab thumb. Okay, so the pollis matlab thumb and hallux matlab great toe. So extensor hallucis longus is supplying the great toe. It's attached, not supplying, it is attached to the great toe. Okay, and the first tendon of the extensor digitorum longus. So ये दो tendon के बीच में you will have this artery, that is the dorsalis pedis artery. ठीक है? So question mostly comes on these two tendons, and it is often palpated in patients suffering from your vaso-occlusive disease of the limb, like Berger's disease. So you can already see that this tendon is an extensor hallucis longus, and another tendon you will have the extensor digitorum longus. In दोनों के बीच में you have the artery, that is the dorsalis pedis artery. ठीक है? So mostly the question comes on the how do you palpate the dorsalis pedis artery. I hope it is clear to you. So you know the two tendons are your extensor hallucis longus and the first tendon of extensor digitorum longus. ठीक है? Now we have finished the leg part. Okay, the anterior compartment, the posterior compartment, and the lateral compartment. Now we are proceeding towards the dorsum. Very important, because many questions to come on the dorsum of the foot. So any question regarding the compartments of the leg in the chat box? किसी को कोई doubt है? Okay, so we'll proceed to the next part. That is the dorsum of the foot. Now here you can see certain cutaneous innervation. So you can see that the medial aspect is supplied by the saphenous nerve. Okay, most of the dorsum is supplied by the superficial peroneal nerve, except the first web space, which is supplied by the deep peroneal nerve. इतना तक पता है? And the extreme medial most part, the medial margin of the little toe, that part is supplied by the sural nerve. So you have to remember the four nerves. On the medial side you have the sural nerve, on the lateral side you have the saphenous, and the first web space you have deep peroneal, and baki sab superficial peroneal nerve. Similarly you can see here that this is the superficial peroneal nerve. It will give two branches. It will give the medial branch, and it is also going to give the lateral branch. Okay, then you have the saphenous nerve here. Okay, and the first web space is supplied by the deep peroneal nerve, and the most medial most part is supplied by the sural nerve. Okay. Okay, so the question came on 2018 that the first web space of the foot is supplied by, तो इसको तो अभी पता ही है क्या आंसर है. It is supplied by the deep peroneal nerve. As you can see, the first web space is supplied by the deep peroneal nerve. The question आ चुका है. That's why I'm again and again asking. Whenever there is an exception, wherever you will get an exception, the question will come on that only. Okay? So the first web space is supplied by the deep peroneal nerve. Now, on the dorsum, you have a retinaculum that is known as the extensor retinaculum of the foot. So, you have two extensor retinaculum. The superior one, okay, it is just a broad band, and the inferior one, important, that is the Y shape. The inferior retinaculum is Y shape. You have to remember this. The inferior retinaculum, extensor retinaculum is Y shape, and the stem of the inferior retinaculum, okay, it lies on the lateral aspect. Okay, the other two in the you have upper band and the lower band of the inferior extensor retinaculum, it lies on the medial aspect. So just try to remember the stem of the inferior retinaculum will lie on the lateral aspect. Now, what are the structures passing under the extensor retinaculum? So, these are the tendons of the muscles from the anterior compartment, है ना? So, anterior compartment का जो muscles था, so you know that there is tibialis anterior. You have tibialis anterior. Okay, you have extensor hallucis longus, and you have the extensor digitorum longus, or you also have the peroneus tertius. So those tendons will pass, and then you will be having a nerve, that is the anterior tibial nerve, that is also known as the deep peroneal nerve, and you will have the anterior tibial artery and vein. ठीक है, तो anterior compartment का जितना कुछ था सब will pass below the extensor retinaculum. Now you have mnemonics for that. So T for tibialis anterior, okay, H for hallucis longus, A for the artery, anterior tibial artery, N for the nerve, anterior tibial nerve or the deep peroneal nerve, okay, then D for extensor digitorum longus, and P for peroneus tertius. So tall husbands are never dear persons. If you want to remember the mnemonics, you can remember that tall husbands are never dear persons. So ऊंचे husbands जो होते हैं, they are not dear to us. So it's a very funny mnemonic. But you can also remember in a way that all the muscles and all the components of the anterior compartment will pass below the extensor retinaculum. So you have the muscles, that is tibialis anterior, extensor hallucis, extensor digitorum, and peroneus tertius, and you have the anterior tibial artery and the deep peroneal nerve or the anterior tibial nerve. Now muscles, as I have already discussed, it is divided into two groups. So you have a extensive group, extrinsic group, and that extrinsic group are the muscles of the anterior compartment. Those are the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the peroneus tertius. And the intrinsic group on the dorsum of the foot has a muscle, that is the extensor digitorum brevis. So you have one muscle on the intrinsic group, that is the extensor digitorum brevis. Okay. Now also I want to tell from medial to lateral if you want to see. Okay, now first you identify which is medial, which is lateral. This is lateral. As you can see the lateral malleolus here, okay, and this is medial. As you can see the great toe, okay. Now from medial to lateral, the most medial structure is the tibialis anterior, that is a tendon of the tibialis anterior. Okay. So after tibialis anterior, tall means tall husbands, tibialis anterior. Then you have husbands के लिए you have the extensor hallucis longus. This is the extensor hallucis longus, which will go to the hallux. Okay. Then you have tall husbands R, A for artery. So you have the anterior tibial artery. After anterior artery, you have the nerve, that is the deep peroneal nerve or the anterior tibial nerve. Are never. Tall husbands are never. And then you have the digitorum, are never dear. So you have digitorum, and then you have peroneus tertius, that is persons. So if you try to remember this mnemonics is from medial to lateral. So the most medial structure will be your tibialis anterior, tall, okay. Then tall husbands, H, A for R never, N for nerve, never, dear, D for digitorum, and P for persons. Tall husbands are never the persons. So from medial to lateral structures under the extensor retinaculum. Okay. And you know that there are two retinaculum, one is the superior and one is the inferior. Inferior retinaculum is in the shape of Y. It's in the shape of Y, and the stem of the Y is towards the lateral aspect. Okay. Okay. As we have extensor retinaculum, we also have the flexor retinaculum. Now the structures passing deep to the flexor retinaculum, again from the medial to the lateral. So here you have tibialis posterior, okay. Then you have the tendon of the flexor digitorum longus. This is flexor, mind you, not extensor, because it is in the flexor compartment. Then you have a artery, posterior tibial artery, okay. Then you will have the posterior tibial nerve and its terminal branches, and then you will have the tendon of the flexor hallucis longus. So here the mnemonics is the doctors are not here, okay. So these are the structures which are passing deep to the flexor retinaculum. So you can see here, you have the tibialis posterior, you can see in this image the most medial, this is the cut section, the most medial structure is the doctors tibialis posterior, then the doctors D for flexor digitorum longus, okay, then R, A for artery, and nerve, posterior tibial nerve, and then you have R naught here, okay, and then you have H for the flexor hallucis longus, okay. So these are the structures passing deep to the flexor retinaculum. So you might get a question on this also, structures passing deep to the flexor retinaculum. So these are the mnemonics. So extensor and flexor both are important. Now identify the mark muscle tendon in the image. So they have given flexor hallucis, extensor digitorum longus, and tibialis anterior. So anybody on the chat box who can answer this question? Anyone who wants to answer this question, that is a marked tendon in the image. So first and foremost, if you see the image, it is the extensor part, okay, it is the extensor compartment, okay. So extensor compartment में flexor तो होगा नहीं, okay. Now it is not towards the digits, okay, it is towards the hallux, ठीक है. So you can see it is going towards the great toe, this tendon. So if it is going towards the great toe, the answer will be your extensor hallucis longus. You know it is in the extensor compartment going towards the great toe, so the answer will be extensor hallucis longus. ठीक है? So here you can see again in this image. Okay, so this is the tibialis anterior. Okay, this is the tibialis anterior. Then you have this tendon which is going towards the hallux, that is the extensor hallucis longus. Then you will have the one which is going towards the digits, that is extensor digitorum. And the most lateral one, you will have the peroneus tertius. Okay, so these are the tendons which might be asked in the exam. Okay. Now you know that the extensor hallucis, its origin is from the, if they have asked you about extensor hallucis, you have to know a little bit about the origin and insertion. So origin is medial 2/4 of the fibula and the interosseous membrane, and then it is inserted on the base of the distal phalanx of the great toe. So you can see here, it is how it is inserted, base of the distal phalanx of the great toe. Now next question is on the X-ray on the tarsal bones. So identify the marked tarsal bone in the given X-ray. So anybody in the chat box who want to answer this, it's very easy. If you see the shape of the bone, you can identify what is this marked bone. So this bone, it has a typical shape, है ना? And this is a navicular bone. ठीक है? So the answer here will be your navicular bone. All right. So this came on 2020. So you may expect some question on the tarsal bones or the carpal bones as well. Okay, because it's very common nowadays. The image-based question. They will give you an X-ray. They will give you a arrow, and they will ask you to identify that. All right. Very good, Aditi Bandal. Yeah, she has answered it correct. Very nice. So see now. देखो इसमें how to identify the bones. So you can see this is the heel bone, the large bone, and this is your calcaneum. Okay, it is bearing whole of our weight. ठीक है, calcaneum के ऊपर में जो bone है that is your talus. ठीक है, उसके बाद which looks like a boat shape or lunar, that is your navicular. याद रखना नेवी इज इन द सी और सी में रहेगा बोट. सो बोट शेप और लूनर शेप इज नेविकुलर. उसके बाद आएगा तुम्हारा 3 क्यूनिफॉर्म. यू विल गेट 3 क्यूनिफॉर्म्स. ओके, एंड देन यू हैव द मेटाटार्सल्स. ओके, at the base of the first metatarsals you will get a sesamoid bone as well. Okay, उसके बाद ये होगा तुम्हारा proximal phalanx and this is your distal phalanx. इतना तो पता ही है. Only about the tarsal bones. So first you know that this is your calcaneus. उसके ऊपर जो होगा bone that is your talus, and you know that navy होता है sea and it the sea में जाता है boat. You know that boat है ना, एंड बोट शेप होता है तुम्हारा नेविकुलर बोन. उसके बाद 3 छोटा छोटा बोन आएगा that is cuneiform, and then you will have the metatarsals, the distal phalanx and the proximal phalanx. Okay, so it's very easy to identify. ठीक है, so if you see this X-ray just before the exam, you try to see this X-ray and then go. और ये चीज़ याद रखना कि जो बोट है वो रहता है सी में और सी में रहता है नेवी, है ना. सो एनीथिंग विच यू सी लाइक अ बोट which is like lunar shape, that is your navicular bone. ठीक है. Okay, so this X-ray is important for your exam. इस बार they have asked about navicular, next time they might ask about talus. So talus has also been repeated in one of the FMG. Okay, तो talus को identify करना बहुत easy है. You just see the calcaneum, उसके ऊपर जो बोन है that is the talus. ठीक है. Which bone in the foot is not attached by any muscle? ठीक है. You have the calcaneum. This is calcaneum. Sorry, you have a C here. Calcaneum, talus, metatarsals, and fibula. तो इसमें से कौन सा करेक्ट आंसर है? द आंसर विल बी टेलस. Talus has all the ligamentous attachment, but it doesn't have any muscular attachment. ठीक है, सब ligamentous attachment है talus में, but muscular attachment नहीं है. Okay, so you can see this bone here. This bone is the talus. ये हो गया calcaneum, तो ये हो गया talus. Now you have so many ligaments. You have, you know that you have a talocalcaneal navicular joint. You have a talocalcaneal ligament. Okay, you have a posterior tibiotalar ligament. You have a anterior tibiotalar ligament. Okay, you have so many ligaments attached to the talus, but you don't have any muscles attached to the talus. So that is typical about the talus bone. ठीक है, so talus bone में सब कुछ है तुम्हारा ligament, but muscle नहीं है. So the answer will be talus. ठीक है. What is the name of the marked artery? So anybody from in the chat box wants to answer this. ये कौन सा artery है जो मैंने purple arrow से mark किया है? What is this artery? Anybody who wants to answer this question? What is this marked artery? थोड़ा सोचो ये कौन सा artery हो सकता है? ये कौन सा aspect में दिखा रहा है bone? क्या ये आर्टरी पीछे से आ रहा है? What is this artery? कुछ तो आइडिया होना चाहिए तुम लोगों को कौन सा आर्टरी है. इसमें ऑप्शन दिया हुआ है लैटरल प्लांटर, मीडियल प्लांटर, डीप फेरेंजियल एंड पोस्टीरियर टिबियल. प्लांटर तो ये है ही नहीं फर्स्ट एंड फॉरमोस्ट. और डीप फेरेंजियल कौन सा है, क्या है, सुना है कभी तुम लोग ने कौन सा ना आर्टरी है? कुछ खास है डीप फेरेंजियल के बारे में, या फिर क्या ये पोस्टीरियर टिबियल हो सकता है? Yeah, so she has answered, Aditi, that's correct. It's posterior tibial artery. It's very easy to remember. In the posterior compartment you have only one artery which is important, that is the posterior tibial artery. पीछे तरफ से जा रहा है. ठीक है, आगे में अगर जाएगा, if they ask you any question on the anterior aspect, that will be mostly your dorsalis pedis. अगर पीछे में they have asked you, the most important artery is the posterior tibial artery. I have told you that they will ask you question on the posterior tibial pulse or sometimes in a diagrammatic image as well. Okay, so this artery is so important. Har saal it is repeated. Either you will get a question on dorsalis pedis, either you will get a question on posterior tibial artery, or you will get a question on popliteal artery. इन तीनों में से तो एक आना पक्का है, because it has been repeated in every exams every year. Okay, so the answer here is your posterior tibial artery. Now, next question is a bit difficult. If you try to remember a dermatome, then it's easy for you. So, dermatome of the area marked with the arrow. थोड़ा ध्यान से देखो. This is the anterior aspect. So, they have marked this area. मतलब anteriorly they have marked the medial surface, medial part. ठीक है, posteriorly भी ये एरिया है. medial aspect mark किया है. Okay, so इसमें कौन सा dermatome होगा? So before guessing the answer, let us study a little bit about the dermatome so that you can answer it well. अगर लेग पे देखोगे, let us come to the anterior aspect, the leg. So mostly the medial most part, ये है तुम्हारा ग्रेट टो. पहले अपना टो को देख लेना. तो फर्स्ट गेट ओरिएंटेड विच इज मीडियल, विच इज लैटरल. सो दिस इज मीडियल, दिस इज लैटरल. So medial most part का dermatome is your L4. Okay, the most lateral aspect towards the little toe. मैंने बोला था इसमें कौन सा नर्व होता है, इसमें सूरल नर्व होता है ना, सूरल नर्व. तो that dermatome will be S1. Okay, और बीच में जो है that will be of L5. तो leg में mostly you have L4, L5 and S1. So if you come from medial to lateral, you have from most medial you have L4, then L5, then S1. And above the knee you have L3. और थाई में रहेगा L2, एकदम ऊपर में L1, टुवर्ड्स द ग्रॉइन यू विल हैव S2। ठीक है, तो L1, L2, L3 हो गया थाई में। नी के नीचे फ्रॉम द मीडियल टू लैटरल यू हैव L4, L5 एंड S1। ठीक है, नाउ इफ यू गो टू द पोस्टीरियर एस्पेक्ट, okay, in the posterior aspect this is medial, this is lateral, okay, now towards the gluteal region एकदम ऊपर में the dermatome will be L1, okay, towards the gluteal region you have S3, S4 and S5, okay, on the lateral aspect, this is lateral aspect, or the lateral aspect upper part you have L2, most of the posterior aspect means back of the thigh is S2, लेग में अगर आओगे इट इज सेम, द मीडियल पार्ट इज L4, ये थोड़ा अलग है, द लैटरल मोस्ट पार्ट, ऑल द लैटरल मोस्ट पार्ट इज द L5 और बाकी सब होगा S2, the most lateral one will be the S1. So mostly they are asking about the in the question they have marked the medial aspect. If you see they have marked the medial aspect of the leg. ठीक है, if you see the question you can see पहले जब डर्माटोम देखोगे ना पहले ओरिएंट हो जाओ कौन सा मीडियल है कौन सा लैटरल, उसके लिए ना पहले यू सी द ग्रेट टो, तो ग्रेट टो हो गया, तो ये हो गया मीडियल, ये हो गया लैटरल। ठीक है, ये हो गया मीडियल, ये हो गया लैटरल। नाउ दे आर आस्किंग ऑन द मीडियल एस्पेक्ट, सो दिस इज L4 एज डिस्कस्ड, ये हो गया L4, दिस इज L4। ठीक है, this one here will be S1, okay, and this is your L5। ठीक है, इधर आएगा L5, इधर आएगा S2 और इधर आएगा तुम्हारा S1। okay, so the answer here will be your, the correct answer here will be your L4। ठीक है, the correct answer here will be your L4। just try to get oriented first, पहले देखो कि great toe किधर है। okay, once you get oriented you know that this is medial, this is lateral, this is medial, this is lateral, and then you can answer easily। ठीक है, तब तो easily answer कर सकोगे। so this is your L4। ठीक है, so that's how you attempt the dermatomes। okay, ये हो गया L4। good, very good, most of the people have answered it L4, very nice। so you got it now। कैसे, so you know that below the knee, from medial to lateral, medial to lateral क्या आएगा, L4 आएगा पहले, फिर L5 आएगा, फिर आएगा S1। this is for the anterior aspect। similarly in the posterior aspect you will get again L4, ऊपर साइड में रहेगा S2, नीचे रहेगा S1 and then you will have L5। ठीक है, so try to remember this image and then it will be easy for you, the dermatome। okay, any question can come on the dermatome। if they have given you this medial aspect, next time they might ask you about this part, so ये part on the anterior aspect towards the little toe, this is by S1 है ना। if they are asking about this area, this is your S2। if they are asking about the lateral aspect on the posterior side, this is lateral, so this is your L5। अगर इन लोग ने इधर पूछ लिया next time, this part, this is L5। so it's important for you to get oriented medial to lateral। ठीक है, okay, now let us come to that interesting part, that is the bursa around the knee। okay, अभी हम लोग ने bursa तो पढ़ ही लिया है, so let us revise once। so पहले क्या आइडेंटिफाई करना है, पहले पेटेला आइडेंटिफाई करो। पेटेला के ऊपर जो बरसा होगा उसको क्या बोलेंगे हम लोग, ऊपर, सुप्रा, सुप्रा मतलब अबोव, सो दिस इज द सुप्रा पेटेलर बर्सा। पेटेला के आगे अगर होगा, इन फ्रंट ऑफ द पेटेला, दैट इज द प्री पेटेलर बर्सा। Now, if it is subcutaneous, then it is known as subcutaneous prepatellar bursa, and you will also have a deep prepatellar bursa also. Okay, deep sorry, not prepatellar, deep infrapatellar bursa also. So प्रीपेटिलर सबक्यूटेनियस हो गया, फिर हम लोग जाएंगे डीप और पेटेला के नीचे है. सो दिस इज इंफ्रापेटेलर, ये हो गया अंडर साइड में, सो इट इज डीप. ओके, इट इज डीप. और अगर ये सबक्यूटेनियसली होगा तो इट इज योर सबक्यूटेनियस इंफ्रापेटेलर बर्सा. ठीक है, वेरी इजी टू नाउ रिमेंबर. पहले हम लोग को क्या देखना है? फर्स्ट ऑफ ऑल वी हैव टू सी द पेटेला. फर्स्ट ऑफ ऑल आइडेंटिफाई द पेटेला बोन. पेटेला के अगर ऊपर हो गया तो सुप्रा पेटेलर बर्सा, पेटेला के नीचे हो गया तो इंफ्रा पेटेलर बर्सा. अभी इंफ्रा पेटेलर दो टाइप्स है, वन इज सबक्यूटेनियस एंड वन इज डीप. और पेटेला के आगे अगर हो गया, आगे मतलब प्री पेटेलर बर्सा, है ना. व्हाट इज दिस बर्सा? इसमें क्या क्या है? यू हैव द sartorius, द gracilis, द semitendinosus, फॉर्म्स लाइक अ गाई रोप, है ना, गाई रोप. और उसके बीच में एक गूस फूट टाइप बर्सा था, उसको बोलते हैं हम अंसराइन बर्सा. इट इज ऑन द मीडियल एस्पेक्ट. ओके, और बिलो द टेंडन, ये टेंडन ऑफ सेमी मेम्ब्रेनोसस है, इसके नीचे एक बर्सा होता है, दैट इज योर बर्सा ऑफ द सेमी मेम्ब्रेनोसस. ठीक है, ऑन द मीडियल एस्पेक्ट. अच्छा, और दो बर्सा है. इफ यू सी हियर, देयर इज दिस tendon of popliteus. So bursa under the tendon of popliteus. Okay, you also have a bursa under the fibular collateral ligament, and you also have a bursa under the tendon of biceps. So these are like small bursas. Mainly they will ask you a question regarding the suprapatellar, the prepatellar and the infrapatellar. Now the interesting part here is the housemaid's knee. ठीक है, ये आता है क्वेश्चन एग्जाम में, नीट में तो आता है. सो इन FMGE ऑल्सो इट माइट गेट रिपीटेड. सो हाउसमेड्स नी में कौन सा बर्सा इन्फ्लेम होगा? सो द बर्सा इन्फ्लेम इज द प्रीपेटेलर बर्सा, mostly the subcutaneous. It is subcutaneous only, prepatellar bursa. So prepatellar bursitis is known as housemaid's knee when there is friction of this bursa against the patella when it come in contact with the ground. तो housemates जो maids है ना, उन लोग जब पोछा लगाते हैं, so when they used to wipe the floor, this part of the knee is inflamed. So this is known as prepatellar bursitis. ओके, एंड प्रीपेटेलर बर्साइटिस जो इधर दिख रहा है, दैट इज योर हाउसमेड्स नी. ठीक है, तो अगर ये गिव यू एन ऑप्शन लाइक हाउसमेड्स नी इज विच ऑफ द फॉलोइंग, द बर्साइटिस ऑफ विच ऑफ द फॉलोइंग, सो दे विल गिव यू ऑल द ऑप्शंस लाइक प्रीपेटेलर, सुप्रापेटेलर, इंफ्रापेटेलर. तो तुम लोग को सोचना है कि मेड व्हेन दे वाइप द फ्लोर, दे विल बेंड डाउन एंड देयर नी विल टच द ग्राउंड. सो पेटेला के आगे जो बर्सा है, that is the most common bursa which is going to get rub against the floor. So that is known as prepatellar bursitis or housemaid's knee. Next हो गया है clergyman's knee. Okay, clergyman's knee. Now clergyman's knee is the inflammation of infrapatellar bursa, subcutaneous infrapatellar bursa, not the deep. Now here also friction of the bursa occurs, but it occurs against the tibial tuberosity, and this is during kneeling. Okay, so you have seen the Christian priest or the clergyman, you have seen how all the Christians, you know, they just kneel down and they pray. So if you kneel down for a long time while praying to God, then your the bursa, that is the subcutaneous infrapatellar bursa, that will be rubbed against the tibial tuberosity. So that is known as your clergyman's knee. ठीक है, तो if they ask you about prepatellar bursitis, prepatellar, पेटेला के आगे जो housemates में होता है, that is the housemates knee. And if a clergyman is kneeling down praying for a long time and infrapatellar bursa में inflammation हुआ, then it is clergyman's knee. So infrapatellar clergyman, prepatellar housemates. Now what is Baker's cyst? As already discussed, there is a bursa deep to the semimembranosus, and if there is bursitis there, it is known as Baker's cyst. Now this Baker's cyst has a cystic swelling if there is and this occurs in the popliteal fossa. ठीक है, अगर popliteal fossa में pulsatile swelling हो, okay, pulsatile swelling in popliteal fossa, then what is the diagnosis? Anybody in the chat? Pulsatile swelling in the popliteal fossa, उसका diagnosis क्या होगा? What is the diagnosis of pulsatile swelling in the popliteal fossa? Anyone in the chat? So anything which is pulsatile, I told you, anything which is pulsatile is aneurysm. And aneurysm in the popliteal fossa is known as popliteal aneurysm. So every time they ask question on a swelling on the popliteal fossa, so just you see whether it is pulsatile or whether it is cystic. If it is cystic, it is Baker's cyst or popliteal cyst, and if it is pulsatile, then it is popliteal aneurysm. ठीक है, तो इसमें भी क्वेश्चन आ सकता है. Okay. Now, what are the main movements of the knee joint? So, flexion of the knee joint. I already told you that there is a group of muscle which is your chief muscle, and there is another group of muscle that is helpers. Those are accessory muscles. Okay. So, chief muscles are your semimembranosus, semitendinosus, and bicep femoris. Very, very important for exam. Flexion of the knee joint. Flexion of the knee joint by semimembranosus, semitendinosus, and biceps. They might give you other also like popliteus, sartorius, but these are accessory muscles. So अगर accessory के बीच में chief muscle हो, then you have to tick mark the chief muscle. What is the main muscle which is helping in extension? So the main muscle helping in extension is your quadriceps femoris, and tensor fascia lata will help it. Okay, so quadriceps femoris for extension, semimembranosus, semitendinosus, and biceps femoris for flexion. Medial rotation के लिए, for medial rotation you have semimembranosus, semitendinosus, and popliteus, and for lateral rotation you have biceps femoris. So this chart is very important for you to remember. I hope you just try to remember this chart and it will be easy for you. Okay. Now let us come to the difficult part, that is most of you find it difficult, I don't know why, but it is very easy if you understand it well. That is locking and unlocking of the knee. Okay. So locking of the knee and unlocking of the knee. So locking of the knee में क्या होगा? In the locking you will have medial rotation of femur on tibia during the terminal phase of extension. All the lines are important. Okay? Locking, medial rotation of the femur on the tibia during the terminal phase of extension. It is brought by which muscle? It is brought by quadriceps femoris muscle. Very important, asked in exam. Locked knee becomes absolutely rigid and the ligaments are taut. Okay, that's about locking. And unlocking, in unlocking you will have lateral rotation of femur on tibia in the initial phase of flexion. Okay, and it is brought by which muscle? It is brought by the popliteus muscle. Unlocked knee can be further flexed and all the ligaments will be relaxed. Okay, so you can see here in this image, if there is medial rotation, so medial rotation matlab locking when the knee is fully extended, and lateral rotation means unlocking, that is initiating the flexion. Okay, so you try to remember locking, ठीक है, लॉकिंग, मीडियल रोटेशन एंड टर्मिनल फेस ऑफ एक्सटेंशन, ठीक है. And about unlocking, you have lateral rotation, okay, and then unlocking you have lateral rotation, and then it is in the initial phase of flexion. Just try to remember these three initial, okay. So if you see LME इसमें क्या है, लॉकिंग में क्या होता है, मीडियल रोटेशन और एक्सटेंशन का टर्मिनल फेज, ठीक है. और अनलॉकिंग यूएलएफ में क्या होगा, अनलॉकिंग, lateral rotation and initial phase of flexion. Just try to remember these three letters, LME and ULF, ठीक है. Locking, medial rotation and terminal phase of extension, and unlocking, lateral rotation and initial phase of flexion, ठीक है. और मसल्स को याद रखना ही होगा, लॉकिंग में क्वाड्रिसेप्स फेमोरिस है एंड अनलॉकिंग में है तुम्हारा पॉप्लिटियस मसल. So the next question, I hope you can answer this. Which muscle is responsible for unlocking of the knee? Unlocking of the knee में which of the following muscles? So they have given semimembranosus, semitendinosus, quadriceps femoris and popliteus. तो कौन सा मसल होगा इसमें? Anyone? I want answer in the chat box. It's very easy. अभी अभी हमने पढ़ा है locking and unlocking. So what is the answer? Muscle responsible for unlocking of the knee. Anyone who wants to attempt this? Abhi just now we have studied. Unlocking of the knee joint is produced by which of the following muscles? Yes, the answer here, you are right. The answer is popliteus. Okay, so you can also remember one more mnemonics which I have made myself. So you know that locking, medial rotation, extension, ठीक है, and it is by quadratus femoris, ठीक है. Unlocking, what is unlocking? Lateral rotation, flexion, and it is by popliteus, ठीक है. QLME and PULF ये दोनों याद रखो. So quadratus femoris, locking, medial rotation, extension, and popliteus, unlocking, lateral rotation and your flexion, ठीक है. So that is initial terms. Okay, what is the main extensor of the knee? Come on, I want to answer from the chat box. अभी अभी हमने पढ़ा है. What is the main extensor of the knee? Extensor of the knee. What is the main extensor of the knee? Anyone who wants to answer? Just now we have studied semimembranosus, semitendinosus, bicep femoris. All are your flexors of the knee. Okay. So I have given actually this is a typing error. The answer here is your quadriceps femoris. It has been written 2 times. So semimembranosus, semitendinosus and biceps. These 3 are the flexors and quadriceps it is the extensor, ठीक है. So the answer is your quadriceps femoris. Just now we have seen this chart, ठीक है. इधर में हमने पढ़ा है flexors में है semimembranosus, semitendinosus, bicep. So the question came on extensor. Next time the question may come on flexor. All of the following helps in flexion of the knee joint except, and then there will be the quadriceps. So quadriceps is in extension and semimembranosus, semitendinosus and bicep is for flexion, ठीक है. Which of the following muscle is the everter of the foot? I want a quick answer from in the chat box. Everter. Everter का meaning क्या है? I already told you. Everter will be in which compartment? Lateral compartment. Lateral compartment. Lateral compartment में दो ही मसल है. Peroneus longus and peroneus brevis. So those are the chief everter. ठीक है, तो इधर में कौन सा आंसर होगा? The answer will be peroneus longus. Okay, so the everter are mostly produced by the lateral compartment muscle. Lateral compartment में you have peroneus longus and peroneus brevis, and option given here is peroneus longus. So this is a table. So inversion and eversion. So you know that eversion, the question came on eversion. So you have the lateral compartment muscle, peroneus longus and peroneus brevis. These are the principal muscle. Peroneus tertius is the accessory muscle. So never, if they gave you accessory muscle in the option, so don't tick mark the accessory muscle. You have to tick mark the principal. Okay. So for eversion, you have peroneus longus and brevis, and for inversion, you have tibialis anterior and tibialis posterior. So freeze these two things in your mind. For inversion, tibialis anterior and tibialis posterior, and for eversion, lateral compartment muscle, that is longus and brevis. So with this I end today's topic. I hope you understood it well, whatever I taught, and any doubt you have, you might ask me in the chat box. Okay, any doubt regarding the lower limb? So we have almost covered everything in the lower limb. So I want you to revise again, okay, the topics which I have already told you. So popliteal fossa is important, okay? Popliteal fossa is important, the compartments of the leg, and out of everything, the one slide which I want everyone of you to remember, a single slide which will solve all your problems in the lower limb, mostly in the leg, and that single slide is the cross section of the leg. Let me show you that slide, and with that I will end it. So this is a single slide which you should remember out of all the slides. If you remember the slides, half of your problem is solved. So you know that anterior compartment, the nerve to the anterior compartment is anterior tibial nerve or a deep peroneal nerve. The artery in the anterior compartment is the anterior tibial artery. In the posterior compartment, the nerve is your tibial nerve, and the artery is both posterior tibial artery and the peroneal artery. And in the lateral compartment, the nerve is the superficial peroneal nerve. So if they ask you what is the nerve supply of peroneus longus, anybody in the chat, what is the nerve supply of peroneus longus? From this you know that peroneus longus and peroneus brevis, peroneus longus and peroneus brevis are in the lateral compartment. So what is the nerve supply of peroneus longus? Anybody in the chat box? What is the nerve supply of peroneus longus? So the nerve supply of peroneus longus and the peroneus brevis is your superficial peroneal nerve. Okay. What is the nerve supply of soleus? You know that the soleus is in the posterior compartment. So the nerve supply is your tibial nerve. What is the nerve supply of tibialis anterior? The nerve supply will be your deep peroneal nerve. So this is a single slide which will solve all of your problem. If you try to remember this cross section, this transverse section, half of your problem is solved. Once you remember that anterior compartment में deep peroneal है, lateral compartment में superficial peroneal, posterior में tibial, then you can also answer the question. Okay. So with this I end today's topic. I hope you understood well whatever I have taught. Any doubt you can ask me in the chat box, or you can email me as well. These are the most common questions which are repeated in the exams again and again every time. So I am mostly focusing on the repeated question and the important topics. Okay, so I hope you understood my session well, and in the next session we will start the systems. Okay, so I will start with the CNS. So in the next session will be on the CNS, and CNS is very important and it's complicated. So I hope you attend my next session as well, so that you understand the CNS properly, the neuroanatomy, the difficult part, right? So it will also help you in attempting the question in medicine as well as in surgery. Okay, lots and lots of CT scan they used to give in the FMG exam. So if you understand the anatomy well, you will also be able to attempt the medicine and the surgery question. So next session will be on the CNS, and वही तुम लोग पढ़ो लास्ट मोमेंट में क्या पढ़ना चाहिए एनाटॉमी में. लास्ट मोमेंट आई थिंक यू शुड गो विद द डायग्राम्स. okay, if you have to revise, I want you to revise the diagrams. okay, now क्या पढ़ना चाहिए FMG एग्जाम से पहले. any question might come, okay, from everywhere it might come, but I want you to focus on the repeated questions. Like पूरे सेशन में in this class, the one question which has been repeated again and again is the posterior tibial artery. तो तुम लोग को थोड़ा आइडिया हो ही गया है कि posterior tibial artery हमेशा रिपीट होता है alternate years, so it is important. Along with that you have to see the artery. ओके, तो आर्टरी का ब्रांचेस अगर posterior tibial आया है तो anterior tibial भी आ सकता है नेक्स्ट टाइम. सो विद दैट यू ऑल्सो स्टडी द anterior tibial. एंड एनाटॉमी में तो सब कुछ ही इम्पॉर्टेंट है, ठीक है. सो if they might give a question on the x-rays and the images. Nowadays they are repeating the image based question. okay, like I asked you the question on the x-ray of the tarsal bones. ठीक है, तो x-rays और image देखो. okay, you try to see the diagram, the images, तभी याद रहेगा. okay, just before the exam go through the images. I don't want to go through any of the notes or any of the mnemonics. mnemonics ज़्यादा मगअप करके तो फ़ायदा है नहीं. So if you try to understand a diagram, like in this diagram, देख के समझ में आ रहा है, now you can attempt any question on any of the nerve supply of the muscle. I guarantee you, if you understand this diagram, any of the muscle, किसी मसल का नर्व सप्लाई अगर मैं तुम लोग को पूछूं, ये डायग्राम देख के तुम लोग बोल सकते हो. तो एक दो ऐसा डायग्राम है, द हॉट डायग्राम्स विच यू हैव टू कीप इन माइंड. ठीक है, वो अगर याद रह गया तो इट विल बी वेरी इजी फॉर यू टू अंडरस्टैंड. ठीक है, ऐसे जैसे मैंने बोल दिया कि लैटरल कंपार्टमेंट इवर्टर है, तो इफ नाउ यू नो दैट लैटरल कंपार्टमेंट में दो ही मसल विच विल कॉज इवर्शन, पेरोनियस लॉन्गस एंड पेरोनियस ब्रेविस, है ना. सो दोज आर द ट्रिक्स विच यू शुड नो. ओके, so also I will tell you in subsequent session what are the important things you can revise, what are the tricks and how to study the anatomy. okay, कैसे anatomy पढ़ो so that you can attempt the question. okay, you have to understand the anatomy, don't try to mug up. I'm telling all my students, mug up अगर करोगे तो कुछ नहीं होगा. if you understand the anatomy you will be able to attempt all the questions easily. and understanding इतना problem नहीं है, थोड़ा time लगता है. So I want you to go with me through the sessions so that it will help you in the exam. And I don't want any one of you to miss the CNS session, because CNS is difficult, it's complicated. Lower limb is the most easiest part out of all. ठीक है, upper limb is little bit tougher but lower limb is much easier. तो easier part हमने ख़त्म कर दिया है. ठीक है, अभी now we are going to start with the CNS, the difficult part. So next session I hope everybody should attend it. okay, and it will help you in your long go. okay, after FMG if you are trying to crack the entrance exam, it will help you in that also. okay, so with that I end today's session. Any questions regarding, any doubt regarding today's session, any questions, any doubt you might have, you may contact me, you may ask me. I'm already always there to help you. ठीक है, and if you want me to improve, okay, any feedback you want to give that I should improve in this point and that point, I will take it as a good feedback, right? So all the diagrams in one season before FMG. obviously it is possible because you know that visual memory is more sharp, है ना. तो अगर visual जो तुमको दिखता है वो ज़्यादा याद रहेगा, right? आज जो मैंने डायग्राम सी, आई हैव मोस्टली मेड माई स्लाइड्स ऑन इमेजेस, सो जो दिखोगे वो ज़्यादा याद रहेगा, है ना. तो विल डू अ क्रिस्प एनाटॉमी सेशन. येस, विल डू अ क्रिस्प एनाटॉमी सेशन बिफोर एग्जाम. आई विल डू द रिविजन ऑफ एवरीथिंग. ओके, mostly focusing on the images. Okay, and I want a quick response from everyone in that session. We'll do it, okay, before the exam we'll do it definitely, but now as scheduled we'll take the CNS in the next session. All right, and thank you very much. Any feedback, negative or positive, please comment. Okay, the negative feedback also I will take it in a positive way so that I can improve myself. All right, and I'm always there to help.